Alofa lava, this is Pacific Waves from RNZ Pacific. I'm Susana Suisuiki. Coming up,
we're looking at getting the results in that hopefully 11 o'clock election night.
American Samoans cast their votes on the same day as the US elections. Also,
at this point in time, other than if you're born in the Cook Islands and you have a birth certificate, there is no way that you could actually prove that you're a Cook Islander.
the Cook Islands want their own passports, and later on, stark findings on child mortality rates in Kiribati. American Samoans are heading to the polls for the general election, the same day as the US election. They'll be voting for a new governor and deputy, a delegate for Congress and House of Representatives, which is the lower house of the American Samoa whānau, where 21 members serve 2-year terms. Despite being a US territory, American Samoans cannot vote for a US president, but can only vote for a delegate to represent them in Congress. This year, there are 4 female choices for Congress, where the American Samoa delegate will be a non-voting member. People born in American Samoa are not automatically US citizens, but are instead considered US nationals. Alicia Foon spoke with Deputy Election Officer Whiti Tawai about Election Day.
Yeah, so far, well, we're ready for our election. For American Samoa, we have already registered 15,954 registered voters who will be participating for the general election November 5th, 2024.
And when it comes to voter turnout, is this a higher number than the previous elections?
We hope that the turnout will be good for this election. Hopefully, we're pushing out all the registered voters to go out and vote. Hopefully, it'll be a good turnout this election.
And in terms of the congressmen or congresswomen, how does that work for people that are interested in knowing a bit more about how the general election runs alongside the US election?
It's similar to our governor and lieutenant. There's about four of them running for Congress. There will be no runoff for whoever that's going to be leading. That will be the winner for our Congress.
And how many districts will be voting for the House of Representatives?
17 districts and 44 polling places.
And how do people feel with the US election being so close as well? It obviously happens on the same day. Can you describe to me what it's like being a US citizen, but also in the Pacific, as a Pacific Islander, and how you navigate not being able to vote for the president despite being a US citizen?
We don't vote for president, but we vote for our governor and our congressional and our representative to the whānau. But in terms of voting for presidential, unless they are registered in each state in the United States, then they can vote in one of the states for the presidential election. But when they are registered with our election office here in American Samoa, they can only vote for our governor or our congressional and our representative.
Okay, and what time do the polls close and how long does it take for results?
Polls open at 6 a.m. in the morning and closes at 6 p.m.
And usually how long does it take for the results?
We're looking at getting the results in at hopefully 11 o'clock. Hopefully that we get all the results from each polling places on election night.
The Cook Islands Prime Minister says the nation's constitutional relationship with Aotearoa will not be affected if it creates its own passport. But New Zealand's Foreign Affairs Minister says any new identity document would have implications for the special relationship. Cook Islands is self-governing, but its residents are New Zealand citizens. Caleb Fotheringham reports.
Prime Minister Mark Brown wants Cook Islanders to hold passports from their own nation.
It's for us to be able to recognise our own people, be able to recognise the identity of our people as Cook Islanders. At the moment, we have a stamp in a New Zealand passport or an Australian passport, which signifies a person as a resident of the Cook Islands. This is just, for me, a bit more modernising that particular concept.
Mark Brown says talks with the New Zealand government are underway. He doesn't see how the idea is any different from dual citizenship.
This is an internal matter for the Cook Islands, to be able to recognise Cook Islanders. As I said, this doesn't change in any way our constitutional relationship that we have with New Zealand. New Zealanders are free to carry dual passports. There are a number of New Zealanders who have their passports of other countries.
A spokesperson for New Zealand's Minister of Foreign Affairs says there would be consequences which would need to be ironed out. His words have been voiced.
Any new Cook Islands passport or identity document would have implications for that special relationship and would require careful consideration and discussion.
Cook Islands political commentator Thomas Wynne says the move makes sense.
At this point in time, other than if you're born in the Cook Islands and you have a birth certificate, there is no way that you could actually prove that you're a Cook Islander. If someone hijacked a plane and said, right, all the Cook Islanders, you guys are free to go, it'd be very difficult for us to prove that.
Thomas Wynne says he would love a passport identifying him as a Cook Islander. However, he says the impact on the country's constitutional settings is not clear.
Most Cook Islanders are happy with the situation that we are currently in with the New Zealand passport, and there is no appetite for that to be threatened in any way. No appetite whatsoever.
Thomas Wynne says the idea of a passport should be driven from the community, not from the top.
If we were to sit down 10 people at home in a room and say, okay, what are the most pressing things facing you right now as a Cook Islander living here in the Cook Islands? I hazard to guess that having a Cook Island passport would not make the top 5, let alone the top 10. In fact, I'd probably say not even the top 20.
Prime Minister Mark Brown says he will announce more on the passport idea later in the year, along with plans for celebrating 60 years of independent self-governance with New Zealand in 2025.
A development specialist says there's an urgent need for action to reduce under-5 mortality rates in Kiribati. The country recorded 56 deaths per 1,000 live births in 2015. It's a figure more than twice the regional average of 27 and second only to Papua New Guinea. Rachel Nunn says it's unacceptable given the number of UN and aid organisations that have been working in the country for several decades. She spoke with Koroi Hawkins.
Well, the findings are really stark. Kiribati has the second highest rate of under 5 mortality in the Pacific region, second to Papua New Guinea. I don't think anyone quite realised, perhaps outside of Kiribati, that it was this high. And when I started speaking with the Minister for Health and Medical Services in Kiribati, I was really shocked to learn just how far off track Kiribati is to meeting the Sustainable Development Goal target for reducing child and infant mortality. So extremely stark, extremely concerning.
How does it compare to other countries in the Pacific?
To put it into numbers, Kiribati's under 5 mortality rate, which is calculated in terms of deaths per 1,000 live births in children under 5, is 56. The next closest country after Kiribati is the Marshall Islands, which is 36, so 20 basis points lower. Papua New Guinea is higher than Kiribati, but it is the only country in the Pacific, as I said, that has a higher under 5 mortality rate to Kiribati. The target under the Sustainable Development Goals, under SDG 3.2, is 25. So Kiribati is currently double that. I think here in Australia, I think we might be around 1 or 2. I think New Zealand might be around 2. So when you think about it in those terms, it's, Kiribati is a real anomaly in the data for this region.
What are the specific circumstances for Kiribati that have resulted in it being this far behind?
It's hard to say because it doesn't appear to be a lack of investment. And part of the reason we wanted to draw attention to this issue is because many donors, New Zealand included, and UN agencies other multilateral agencies, UNICEF, World Health Organization, UN Population Fund, and others have been present in Kiribati for decades. So I don't think the problem is that this issue has been missed. We would assume that the strategies that have been employed to address the under 5 mortality rate haven't worked, or haven't worked to the extent that it was hoped that they would. I think, in my opinion, one of the key factors is that the most pressing healthcare needs in Kiribati, which are maternal and child health services, haven't been addressed as much as other health issues have received resources. So if we just look simply at the allocation of resources, there simply hasn't been enough going to maternal and child health services. I think that's one thing, but there was a really great quote that the Minister for Health and Medical Services in Kiribati said, which is that saving children's lives is not a brainstorming exercise. There's actually a real science behind it. And there's enough evidence from other countries in the region of what works and what doesn't work. And just one thing that I would add to that quickly is I think something Kiribati really lacks relative to other countries is community outreach. So health seems to start and stop at facilities in Kiribati. So once you get to a health facility or you get to a hospital, you may be able to access health services, but there's no community outreach. There's no meeting people where they are. There's no nursing outreach program.
So given what's being brought to light here, what is there that can be done about it and will be done about this?
So one thing that Kiribati is already planning to do is implement the new CC-NOP program, which stands for Child Community Nursing Outreach Program. This is a new initiative that is due to kick off from next year. And essentially it is a nursing outreach program. So it involves sending nursing staff out into the community to meet people where they are in their homes, in their communities, and doing that in a really culturally sensitive way, which is super important in a health context, that you don't retrofit the approach that works in one setting in another setting. It's so important that people are comfortable and that the approach to health is very culturally sensitive and fit for the context. So that's the CC-NOP program, which is commencing next year. And that program is being delivered in partnership with Plunkett Nursing in New Zealand, as well as with some support, I believe, from Victoria University of Wellington. And it really highlights the importance of partnerships, and particularly partnerships with NGOs and in very localised health organisations. But one key problem is the recruitment of nurses. And this isn't a problem just in Kiribati. Challenges with the health workforce exist across the region. Recruiting the required number of nurses, but also ensuring that they're trained to an appropriate standard, is essential, because it's nurses that are at the front line of maternal and child health. And so ensuring a robust, effective nursing workforce is really, really critical, not just to reducing child mortality, but to achieving all of the Sustainable Development Goals.
That's Pacific Waves for today. For all episodes, head over to rnz.co.nz/Pacific. We're also on Spotify, Apple and iHeartRadio. From myself and the RNZ Pacific team, so far, sui fua.